Hello, my name is Dr. Steele. Today I want to talk to you about autoimmune disease. Autoimmune disease, in simple terms, is a disease that unfortunately your immune system makes us a proverbial boo-boo. It makes a mistake. Then instead of attacking foreign agents, it starts attacking your own tissues. Therefore, autoimmune disease is not a localized disease. It is a systemic disease. And the reason I'm telling you this is because sometimes as we get older, we start blaming something called osteoarthritis, which is more degenerative joint disease, as if it were to be an autoimmune disorder. So for you have to have an autoimmune disorder, you need to have problems not only in one location, you're going to have problems all over your body. And I want you to recognize that because sometimes we misdiagnose that condition. As a matter of fact, you probably already know that is more commonly found in childbearing age, young people, and your 20s. It doesn't mean that it can happen in your 30s or 40s, but it's less likely. So my point to you is I just want you to be aware of that because the treatment is totally different from something that's localized like osteoarthritis versus somebody that has a systemic disease that affects the joints like lupus or rheumatoid arthritis. So one is treated with medications that are not so, and I don't want to say toxic, but because they do help people, right? Because at that moment, if we don't, we need to use the tools that we have. The things that are more benign than things that we need to use that are more severe or they can have, not severely, but they can have side effects. And we need to recognize that those people that have an autoimmune disorder are going to have systemic disease. So it's important not only to go to the doctor and do a workup, do some blood work, but even though the blood work may be positive, it does not mean entirely that it's an autoimmune disorder. You need to have the blood work not supplement, but also objectively and subjectively, you need to have the symptoms first. And just to give you an example, people that have lupus or rheumatoid arthritis, they have chronic fevers because remember, it's a systemic inflammatory response. As I said in the beginning, when your immune system thinks that your body parts are not yours and it starts rejecting them, kind of like when people get an organ transplant, that's the type of medication we need to use for people that have an autoimmune disorder sometimes or often. But remember, we need to get to the bottom of that. And we cannot just say, oh, you have an autoimmune disorder without doing not only a good clinical history and look a good, a good physical, but also supplement that or complement that with our labs. So that's what message for today. Remember, autoimmune disorder is a systemic condition. And sometimes we think that as we get older, we get arthritis and it is a autoimmune disorder. Talk to you soon.